Hello, my name is Mark Joel Abaso, and I'm a student in the Global Public Health Scholars Program at the University of Maryland, College Park, majoring in neurobiology and physiology. Today, I'll be presenting my practicum project titled A Community in Crisis, the Intersection of Health Insurance and Diabetes. Through my practicum, I explored how low health insurance coverage, or the lack of it, impacts diabetic patients' ability to access life-saving medication. For this project, I worked at CVS Pharmacy, located in White Plains, Maryland. At CVS, I was employed as a pharmacy technician. My primary duties involved assisting pharmacists with medication distribution, processing insurance claims, and interacting directly with patients and picking up their prescriptions. This role gave me direct exposure to the critical link between insurance coverage and patient health outcomes, especially for individuals living with chronic illnesses such as diabetes. As part of my daily responsibilities, I witnessed cases where patients could not afford their medications simply because they did not have access to sufficient health insurance coverage, or in some cases, no coverage at all. I intentionally chose to work at CVS Pharmacy for my practicum because I wanted to be in a setting where healthcare access challenges are visible and tangible. Unlike hospitals, where patients might only interact with the system during emergencies, pharmacies are places where patients visit regularly for everyday medications, especially in cases where patients have chronic conditions such as diabetes. I wanted to observe up close the effects of systemic issues such as insurance barriers, costs, and socioeconomic status on individual health management. This particular project was important to me because diabetes is one of the most common chronic diseases in the United States. According to the CDC, 1 in 3 Medicare beneficiaries has a form of diabetes. Without affordable access to insulin and other diabetic medications, managing diabetes becomes nearly impossible and the consequences can be fatal. Unfortunately, what I observed in CVS highlighted deep inequities in our healthcare system. Many patients without insurance had to make difficult decisions where they would have to choose between either skipping doses of insulin, rationing their current medication, or foregoing treatment altogether. This lack of access disproportionately affected people of lower socioeconomic classes and minority groups. Globally, this pattern repeats itself in low and middle income countries where insulin access is severely limited. Thus, my project touches not just on local public health issues, but on the global crisis of accessibility and affordability. One of the major takeaways from this experience is the understanding of how essential insurance coverage is for health management. Medications such as metformin, Humalog, and Lantus became financially out of reach for many patients once insurance coverage was lost or inadequate. Without access to these medications, patients risk severe complications like kidney failure, vision loss, and even death. This experience showed me that health insurance is not just a bureaucratic detail, but it can be somebody's literal lifeline. It also helped me realize how social determinants like income, employment status, and race directly shape a person's health outcome in real life. If we want to improve health outcomes, we need to manage systemic changes that ensure consistent, affordable, and equitable access to medication, not just for the privileged few, but for everybody. On a personal level, this practicum was deeply meaningful to me. Coming into this experience, I understood healthcare issues in theory and in the classroom through reading textbooks and completing assignments. But at CVS for my practicum project made it a very real and tangible concept to me. Moving forward, this experience has reinforced my understanding of public health goals and outcomes. I aim to advocate and contribute to initiatives that promote health equity, especially in resource limited settings, both locally and internationally. Whether throughout policy work, research, or clinical care, I want to help dismantle barriers that prevent people from accessing the critical medication that they need. This practicum has made me realize that achieving global health equity isn't just about big interventions overseas and across the country, but it's also about addressing systemic inequities and local problems in our communities. Thank you for listening. This is my practicum project, and thank you for listening.